The broadcast of the regularly scheduled Public Health and Safety Committee will now begin.
Hello, everyone, and welcome to this regularly scheduled meeting of the Public Health and Safety Committee for August 12th, 2021. My name is Philippe Cunningham, and I am the chair of this committee. As we begin, I will note for the record that this meeting has remote participation by members of the City Council and City staff as authorized under Minnesota Statute Section 13D.021 due to the declared local public health emergency. The city will be recording and posting this meeting to the city's website and YouTube channel as a means of increasing public access and transparency. This meeting is public and subject to the Minnesota Open Meeting Law. At this time, I will ask the clerk to please call the roll so we can verify a quorum for this meeting.
Councilmember Gordon.
Here.
Councilmember Ellison. Councilmember Cano.
Oh, present. Ellison.
Councilmember Palmisano.
Present.
Vice Chair Fletcher.
Here.
And Chair Cunningham.
Present.
There are 5 members present.
Thank you. Please let the record reflect we have a quorum and can conduct the business of this committee. With that, colleagues, the agenda is before us today. We have 8 items on our agenda. Items 1 through 6 are the consent portion of the agenda, and we'll have 2 discussion items following that. Before we get started, I do see Councilmember Palmisano has put herself in queue. Did you want to go ahead and speak before we moved into this? Moved into our agenda.
Yeah, thank you, Mr. Chair. I fear there's an item missing from this agenda. As you know, every full council meeting, we do a referral of petitions, communications, and reports to all of the proper committees, and those items that we refer get considered by committee at the next regular meeting. This is the subtopic of the email that I sent to you the other day. The number of the RCA that I'm looking for is 884. We referred it 2 cycles ago, and the subject is accepting a donation for the services of Dr. Matt Bostrom to do some shared community values work for policing and recruitment of officers. I'm curious as to why that hasn't shown up yet on an agenda. I thought it would be on the last agenda. Now I don't see it on this agenda.
Yes, thank you for that question. So with this particular item, what we have been doing is trying to coordinate the different work that is happening with public safety engagement efforts in order to make sure that it is all woven together in a systematic way. And so that's why we have been trying to work on that before bringing it before the entire council. This is something that Councilmember Fletcher has also been deeply involved in the conversations. Councilmember Fletcher, did you want to add anything as well? Yep, I see you're in queue. Please go ahead.
Yeah, happy to, Mr. Chair. I actually think the content of the research project is something that people will be supportive of. I think that the way it was coming through, siloed from the rest of the research agenda of the transforming public safety work and the ongoing work in the coordinator's office, I think risks a kind of outreach fatigue. When we have too many community outreach topics on the same topic, people being asked the same questions too many times by the city, we start to not have people believe us that we care. And so we asked for greater coordination. I understand that there's a meeting set up between MPD and at least some staff at OVP in the next week or so. That could hopefully get to some amount of clarity. We've also spoken with, obviously we have a new coordinator, and we've asked the coordinator to be involved in making sure this is compatible with and working in concert with the items that are already in progress. And so we've asked for additional work to show the compatibility of this with the rest of the city's research agenda on public safety. I actually think that that's a doable thing, but I think that the way the RCA was coming through, it reinforces a sort of negative siloing effect that is probably not what was intended, and I think would have a negative impact on the project.
Thank you, Councilmember Fletcher.
Mr. Chair, if I may, thank you for this explanation. I'm really encouraged, and I think that the discussion of this is really important. I also know we need to follow our own rules. I understand that this must come forward and it still hasn't yet. Do you think it's reasonable to say that we could have this the next scheduled committee meeting, so on August 26th?
I think that is a reasonable expectation to be able to do so. Hopefully we will have some of these pending questions and concerns answered by that time. So I think that is a reasonable request. And if we don't quite get to where we are hoping to be in order to have a good outcome or good process in terms of rolling out this as a part of our overall research agenda, we of course can refer it back to committee as necessary once it goes before the full council. So thank you, Councilmember Palmisano, for bringing this forward. Again, the content is not the issue. We want to make sure that we have a good woven together research agenda that really helps us move forward as an entire enterprise. So thank you for that, bringing that up today.
Thank you.
And my apologies for missing your email. Sorry about that. All right, moving to our consent agenda. Again, we have 6 items. Item number 1 is accepting an amended grant agreement by the Minneapolis City Council, acting as the City of Minneapolis's Community Health Board from the Minnesota Department of Public Health in the additional amount of $942,393 to work in partnership with MDH to address the areas of public health responsibility and essential public health services. That's through the end of this year. Item number 2 is authorizing a contract with Metropolitan State University in the amount not to exceed $600,000 for a 2-year period to advance health literacy, to enhance equitable community responses to COVID-19. Item number 3 is authorizing the submittal of a grant application to the United States Department of Justice in the amount of $1,200,000 for a 3-year period to develop, implement, or expand comprehensive programs in response to illicit opioids, stimulants, and other substances of abuse. Item number 4 is accepting the second low bid of Municipal Emergency Services in the amount of $224,400 to provide turnout gear, and authorizing a contract for the project to extend with an option to extend up to 2 years. Item number 5 is authorizing an increase to the revenue contract with the Minneapolis Public Schools Special School District number 1 in the amount of $30,000 for a total amount of $65,000 for COVID-19 case investigation and contact tracing services. Item number 6 is authorizing a number of contracts for the Partnership Engagement Fund. This is connected to the Neighborhoods 2020 work that has been underway. I highly recommend for both my colleagues and the public, if you have not done so, so please check this out on the Legislative Information Management site. There's lots of amazing work being done in partnership with our neighborhood organizations throughout the city. With that, colleagues, I will move approval of all 6 items. Are there any discussion on them? All right. Seeing none, I also do just want to say Councilmember Connell is present. Excuse me, Councilmember Connell is present. So with that, clerk, will you please call the roll?
Councilmember Gordon,
Aye.
Councilmember Ellison,
Aye.
Councilmember Kano,
Aye.
Councilmember Palmisano,
Aye.
Vice Chair Fletcher,
Aye.
and Chair Cunningham.
Aye.
There are 6 ayes.
Thank you, Madam Clerk. Those items carry and will be forwarded to our full council meeting next Friday. I believe that's when it is. With that, we'll move on to our 2 discussion items for today. Our first will be receiving and filing a presentation from the Civil Rights Commission on its proclamation against gun violence, and that will be followed by our monthly presentation update on the COVID-19 pandemic and our city's response to it. So first, I would like to welcome Kayla McConna Diarra, sorry if I said your name incorrectly, as well as members of the Minneapolis Civil Rights Commission to be able to give us this presentation today. Welcome.
Thank you so much, Councilmember Cunningham, and I will turn it right over to the commissioners, but I am here if there are any department-related questions.
Great, thank you so much. Welcome. You may have to push *6 in order to unmute yourself if you are on the phone. Oh, I see somebody came on camera. Hello, welcome.
Hi, I'm Ashley Gold, and I'm on the Minneapolis Commission on Civil Rights. I'm the chair of the subcommittee community engagement, but I'm just waiting for Cindy Devenish, Commissioner Devenish. She authored this proclamation, and so I'm just hoping she's able to get on as well. Thanks for having us.
Chair Devenish, are you on the call? I remember seeing
Yes,
you.
sir, I am. Thank you for having us. It's truly an honor to be here. Thank you so much.
Welcome.
So it is our turn to present. Are you asking if we have any questions?
No, I believe do you have a presentation for today about the?
Yes, sir.
Okay, so take it away. It's all you.
Yes, sir.
Actually,
thank you.
I'm so sorry to interrupt. This is Ken Daler from the clerk's office. We do appear to be having some audio issues with the broadcast of the meeting. So I wonder if we should just pause for a brief moment. I don't know if this is a quick fix or what's going on, but I wonder if we should just pause for a brief moment.
Yes, I 100%. We want to make sure folks hear what's happening. So let's go ahead and how about we take a 5-minute recess in order to resolve this technical issue? Is that okay?
That sounds like a great plan, Chair Cunningham.
Great. We'll be back in 5 minutes.
Thank you.
And if I could just ask, is Mackenzie May, Chair May, are you on? And I'm wondering if she's partly having trouble as part of that actually speaking, because she should be a part of this too.
Okay, test 1, 2, test 1, 2.
Mike, we heard that. I don't know if that was directed to us.
It's a troubleshooting test. I'll tell you one moment if we're back with audio.
Sounds good. Chair Cunningham, since you're still here, I just
Yes.
kind of checked in with Casey. None of the meeting was accessible to the public, so we should.
No.
Yeah, that means we should redo the portions of the agenda where we took action.
Thank goodness we didn't get to the presentations.
Indeed,
yet.
indeed.
Thanks, team, for discovering this issue beforehand. All right,
Yeah,
so
yeah.
let's roll it back. Let me know when we're ready to start over again.
Will do.
Are we still having technical difficulties, sir?
Yes, we're actually going to be having to start the meeting over from the beginning because none of it was actually aired. So we will give you all the cue when it's time for the presentation.
Thank you, sir.
Of course.
Ken and Chair Cunningham, we are back up and running based on our last test. So I guess we can begin again.
Take it from the top.
Yeah, do we need to do like a 1-minute warning again, Mike, or can he just get started?
The live stream is broadcasting right now, so we can just announce that the meeting we're picking up from where we left off.
Okay, sounds good. We do have to kind of redo
Yeah.
the beginning portions of the meeting, but I think that portion will still be recorded, Mike, right? So
Yes.
we could kind of go through it relatively quickly.
Yeah, so we're still recording on Teams.
Great. Thank you. Go ahead, Chair Cunningham.
Do I need to do the consent agenda again?
I think just do a quick read through of it again, and we should do another roll call just to be sure so that the public can see it on the live stream.
Yes, great. Thank you so much. All right, everybody, let's take it from the top. We apologize for the technical difficulties, but sounds like we have everything straightened out. So want to make sure that we get all of this information together. So I will call this meeting to order. So welcome to the regularly scheduled meeting of the Public Health and Safety Committee for August 12th, 2021. My name is Philippe Cunningham, and I am the chair of this committee. As we begin, I will note for the record that this meeting has remote participation by members of the City Council and City staff as authorized under Minnesota Statute Section 13D.021 due to the declared local public health emergency. The city will be recording and posting this meeting to the city's website and YouTube channel as a means of increasing public access and transparency. This meeting is public and subject to the Minnesota Open Meeting Law. At this time, I will ask the clerk to please call the roll so we can verify a quorum for this meeting.
Councilmember Gordon,
Here.
Councilmember Ellison,
Present.
Councilmember Cano, Councilmember Palmisano,
Present.
Vice Chair Fletcher,
Here.
and Chair Cunningham.
Present.
There are 5 members present.
Thank you, Madam Clerk. Let the record reflect that we have a quorum. With that, we will begin with today's agenda, which is before us. We have 8 items on our agenda for today. Items 1 through 6 comprises the consent portion of the agenda, and we will have 2 presentations today. On our consent agenda, we have item number 1, which is accepting an amended grant from the Minnesota Department of Health in the amount of $942,393 to work in partnership with with MDH to address areas of public health responsibility and essential public health services through the end of the year. Item number 2 is authorizing a contract with Metro State University in the amount not to exceed $600,000 for a 2-year period to advance health literacy and to enhance equitable community responses to COVID-19. Item number 3 is authorizing the submittal of a grant application to the U.S. Department of Justice in the amount of $1.2 million for a 3-year period to develop, implement, or expand comprehensive programs in response to illicit opioids, stimulants, or other substances of abuse. Item number 4 is accepting the second low bid of municipal emergency services for turnout gear in our fire department and authorizing a contract for that project with the option to extend for 2 years. Item number 5 is authorizing an increase to the revenue contract with MPS, Minneapolis Public Schools, in the amount of $30,000 for a total of $65,000 for COVID-19 case investigation and contract chasing services through February of next year. Item number 6 is a number 19 to be exact, contracts with organizations for the Partnership Engagement Fund. That work is related to the Neighborhood 2020 work that has been underway for a few years now. I do highly recommend for my colleagues and the public to please look at this item. There is a lot of really great work being led by community-based organizations in partnership with our neighborhood organizations. With that, I will pause to see if there is any discussion on these items. All right, seeing none, I'll move approval of items 1 through 6 and ask the clerk to please call the roll.
Councilmember Gordon,
Aye.
Councilmember Ellison,
Aye.
Councilmember Cano, Councilmember Palmisano,
Aye.
Vice Chair Fletcher,
Aye.
and Chair Cunningham.
Aye.
There are 5 ayes.
Thank you, Madam Clerk.
Councilmember Cunningham, really
Yes.
quickly, I'll just mention, since we did do that roll call vote earlier before the live stream when it was not working successfully, Councilmember Cano did vote in the affirmative on the consent agenda. So
Yes.
if it's okay with you, we will record her as voting aye on that item.
Of course, I 100% am okay with that. I know she's having some technical difficulties, so thank you for that. All right, so now we will move on to our discussion items. Our first item that we will have is receiving and filing a presentation from the Civil Rights Commission on its proclamation against gun violence. And then we will have, following that, our regular monthly update related to COVID-19 and the city's response to it. So I will go ahead and turn it over to, I believe we have Ashley Gold, Cindy Devenish, and Mackenzie May here to speak on behalf of the Minneapolis Civil Rights Commission. So go ahead and bring yourself on camera and unmute yourself. Welcome.
Good afternoon. Can you hear us?
Yes, we can. Are you able to turn on your camera?
We have the camera on. I'm just having some technical difficulties. Please bear with me and I'll go ahead and turn on my camera. Thank you so much for having us today. Can you see us now, sir?
No, we cannot, but that's okay. Go ahead and proceed.
Whether we need to just. Okay, he says just go ahead. Okay, go ahead. It's you.
Commissioner, thank you all for having us. My name is Mackenzie May. I am the chair of the Civil Rights Commission. I'm here today with Cindy Devenish, one of our commissioners, and as well as Chair Gold, who is one of the commissioners on our commission as well, who's also the chair of the Community Engagement and Research Subcommittee that we have. I want to thank everybody for taking the time to meet with us and allowing us to present to the Public Health and Safety Commission. It's truly an honor to be able to speak about the Gun Violence Proclamation and its contents. And we want to, again, thank Kayla and the Civil Rights Department for their ongoing support for the work that we've engaged in. I will go ahead and introduce myself a little bit. I have been on the commission since this year, 2021. This is my first year serving. I've been very grateful to be on a very exciting commission where we've been privileged to just get a lot of work pushed through and support from the department, including our agenda item on gun violence, as well as the African American Preservation Act that we'll be able to continue to touch on and hopefully be able to get more support on that statewide. And so that's a little bit about myself. I want to hand it over to Commissioner Ashley Gold and Commissioner Cindy Devenish to introduce themselves as well.
Thank you. My name is Cindy Devenish. I am currently in Ward 4. I've been on the Civil Rights Commission since 2019, so thank you all. It's truly an honor to be here. We will be talking about the Stop the Gun Violence Proclamation and its contents. Thank you so much. Ms. Gold, do you want to go ahead and introduce yourself?
Commissioner Gold, you're muted.
It's okay. It wouldn't be a meeting without it.
Thank you. Wow. Yes. Wow, I made it all the way through 2021. I think that's my second time. My name is Ashley Gold, and I live in Ward 12. I am the chair of the Community Engagement and Research Subcommittee of the Minneapolis Civil Rights Commission. I have a social work degree, and I'm just really excited to be here, unmuted. And I will pass it over to the author of this proclamation, Commissioner Devenish. Take it away.
Thank you so much, Ms. Gold. Actually, first, we're going to hand it over to Chair May. Okay, so thank you. I'm sorry. Many of you may want to know why we are engaged in this work. As a proud Civil Rights Commissioner in Ward 4, I and other civil rights allies have had ongoing conversations regarding the increased gun violence with community members and community organizations. Unfortunately, I've seen too many, or we as a community have seen too many Black, Indigenous, people of color in our community lose their lives to gun violence. I personally lost 3 loved ones due to ongoing gun violence. One of which, unfortunately, is my nephew, Eric Holloway, who was tragically murdered in Milwaukee, Wisconsin in October 2019. Before someone stole his life in his home, he fought for his family's life by protecting the mother of his children, who was tragically shot multiple times and left for dead, while the young child watched and hid in horror. When I watched the news of the increased gun violence, I knew I needed to do something. I know the pain of losing the loved one, stolen from you and being left behind to pick up the pieces. As of June 1st, 2021, there have been an increase in gun violence in the city of Minneapolis. For instance, a 10-year-old child was sleeping in the back of his car while in a vehicle near 34th and Morgan when a bullet struck the child in the head. On October 30th, 2021, a 9-year-old child was shot in the head while playing outside on 26th and Lyon Avenue North. Sadly, May 15th, after bravely fighting for the child's life, he tragically passed away. Friday, May 28th, 2021. An 8-year-old child was shot and critically injured. The child bravely fought for their life, but lost their battle and died May 18th, 2021. We, as a community, should not have to mourn the loss of our children due to gun violence. We should not have to mourn the loss of any human due to gun violence when we can prevent these heinous actions. Having a Stop the Gun Violence Accountability Task Force can help ensure the community voices are heard, ensure the transparency from the city of Minneapolis. The Minneapolis Civil Rights Commission encourages all citizens to support local community efforts that work diligently to prevent the tragic effects of gun violence and respect and value of human lives. We encourage all responsible gun ownership and pledge to do all we can to keep firearms from wrong hands and to keep children in our community safe. Results from the Racial Equity Impact Accountability helped to provide demographics affected by the gun violence. According to the City of Minneapolis Office of Prevention, City of Minneapolis Health Department, shooting victims in 2021 are reported as following: 81% male, 19% female, 83% Black. Only white were 11%, 3% unknown. Top age groups 17 to 21. City of residents 59%. 41% all other cities. The data unwaveringly clear that Minneapolis Black, Indigenous, and people of color have different experience with gun violence than white communities. In addition to the police department data, journalists, scholars, artists, and activists have pronounced to be more qualitative and narrative data on community experiences with the police. These type of sources help document the lasting impact of trauma, of gun violence. These experiences shape views on civilian oversight. Regarding the community engagement, this needs to be a priority, including ongoing conversation with the City of Minneapolis organizations and its community members. The input that we have obtained and continues to be received when putting together the proclamation, which passed May 17th, 2021. Next, we will discuss the Gun Violence Prevention Day, presented by Commissioner and Chair of the Subcommittee, Community Engagement, Ashley Gold.
Thank you, Cindy. Thank you, Commissioner Devenish. Obviously, we can hear that this proclamation was really birthed out of tragic ongoing loss and lived experience from my fellow commissioner and friend, Cindy Devenish, and what she's experienced in her neighborhood of Ward 4, and what people and our neighbors are experiencing all around the city. So Cindy and I met with Jared Jeffries from the mayor's office. We spoke with him about the Stop the Gun Violence Proclamation. Part of the ask in the proclamation was that Mayor Jacob Frey proclaim a Stop the Gun Violence Day, which he granted and declared July 2nd, 2020 of this year, which we're very appreciative for. But another part of our ask is why we're here today. And we are asking you all to do something, because you have been doing something and you have allies within us at the Minneapolis Commission on Civil Rights. We want the gun violence and the gun terror to be really dealt with a sense of urgency, so we can, because it is a public health and safety issue. And our intention with this proclamation isn't just a piece of paper. We're here to ask you, the City Council, to create a gun violence accountability task force, working in partnership with local organizations like the Office of Violence Prevention, who are already doing this work, and even some local law enforcement. In our research, we found that there was a violence prevention steering committee, but it looks like due to online records, the last time that they met was February 2020. So maybe there's a way we can get that back going and collaborate and not have everybody be siloed, but work together on this issue. And we want to thank you for your commitment to public health and safety here in Minneapolis. And we're urging you today, as our elected officials, to be proactive, to not wait until another innocent life is taken too soon from our city to then react. To address this emergency with the urgency of protecting all of our neighbors here in Minneapolis. And thank you very much again for the work you do. And I'm going to pass the mic to Chair May.
Thanks, Commissioner Gold. This is Chair May here. I want to thank everyone again for taking the time with us. I want to just urge the city officials. This is a public health crisis. It's an epidemic and really concerning civil rights, but not only civil rights, also concerning the human rights of the residents of Minneapolis and much broader. This crisis of an epidemic has really exacerbated since the pandemic, and we want to urge officials to really put together but we need to put our heads together, right? We want this task force to really come to fruition, and there's a bunch of ways that we could consider what that could look like, but we are familiar with some of the violence prevention initiatives happening locally in the city of Minneapolis. We know we have planning to continue engagement with that the Office of Violence Prevention, and we have reached out for a meeting to discuss ways that this could work out with all of the different pockets of work happening around gun violence. We have, understood that there is a lot of silos within, and a lot of people are having this conversation, and so we want to assure that we can bring these things together and really put our heads together and work towards this issue. We want to assure that we are being proactive, that our elected officials are being proactive rather than reactive. That's one way that we can really start to tackle this issue. Along with the Office of Violence Prevention, we will be meeting with, hopefully, we have reached out to the Minneapolis Police Department representatives to be able to start discussing some of the gun violence prevention things happening there. And again, how can we really bring these things together? So that's some of the things that are on our next steps of ways to figure out how this could look. And we're really excited to put our heads together and really put the things happening at the city to work. We understand there's also a violence prevention steering committee, and I think the last agenda item was in February 2020. And so, I want to urge the city officials to really represent that steering committee as well, because, again, after COVID, right, we have an increase in gun violence since 2020, and we want to make sure that we are able to address this. And I think putting our heads together, starting up some of these conversations again, and being really proactive is one way to, and we're actually already at a reactive state, so I'm just going to say that, but how can we continue to move forward and do better? Thanks, everybody.
Thank you so much. Is that the conclusion of your presentation? Great, thank you. All right. So what
Mr. Cunningham, yes, I was wondering, do we have any public comment or comment from the council members? Any feedback on their thoughts on our completion of the racial equity tool and our presentation?
Yes. Well, first, I thank you for bringing that up. I do want to thank you all so much for your due diligence related to bringing this through the city council. Legislative work is not easy work, and you all were very diligent in your work related particularly to our racial equity impact analysis. So very, very impressed and grateful for you all being willing to spend your time doing that. It helps to inform the public in very meaningful ways. I have a couple of council members in queue. So first up, we have Councilmember Gordon, followed by Councilmember Fletcher.
Yeah, thank you very much. I just want to thank you for bringing this forward. You're absolutely correct, and this is a time to get involved. I'm concerned about gun violence with the tragic increases that we've seen in our city, and I'm just impressed that the Civil Rights Commission has decided to take this on and come forward. It sounds like you've done a lot of research too, and I think you should know that you'll have a lot of interested partners in the city council itself, as well as city staff, to see what we could do. As somebody who's been on the council a while, the proliferation of gun violence in our city has been a persistent problem, especially among young adults, and it still is. We are hamstrung because of state law and federal court decisions and all sorts of things about what we can do and what we can't do. But I do think that we have to do more. We sometimes, I think, become complacent because it feels hopeless. We've certainly tried ideas in the past, even our gun buyback programs or things like that, we've done them. They've been somewhat successful. We could do those more. We could look at our legislative agenda. What can we push on? What can we fight to get changed at the state so that maybe we could enact some local rules and regulations and ordinances? You know, we know that the straw purchases, as you call out in your resolution, are a big problem now. We've seen some media recently too, and there has been some arrests and some prosecutions, so that has been hopeful, but it's a daunting problem. And I think the more we can come together and say where we're going to work on it together, the better off we are. So thank you for doing this. If you can't tell, you've already inspired me to pay more attention and to get more involved. And I look forward to seeing what I can do to assist you, work with our city staff and our communities to try to make more progress on this issue.
Great, thank you. Next up, we have Councilmember Fletcher, followed by Councilmember Ellison.
Thank you very much, and thank you all for your work on this. You know, I think you're exactly right that, I mean, this is something that deserves focus. I think it's something that is getting a lot of focus in some kind of pockets of the city. As you said, there's different places that it exists throughout the city enterprise. Obviously, there's you know, even a discussion on the ballot about reorganizing some of that work, and I think that'll shape what that kind of task force looks like. But I think regardless of what happens with the charter amendment and whether some of those efforts get brought together or not, I think you're right that some kind of a task force, some kind of a focused effort that really takes the new tools that we've developed. I think there might not have been something to coordinate had we done this a couple of years ago, right? We've actually developed a lot of new work, as you mentioned, in the violence prevention space that now I think deserves a level of coordination and a new look at, okay, now that we've built, you know, this set of tools, what are the gaps, what's missing, what are the ways that we can coordinate and make this work together better, and how can we make sure that our focus really stays on this, because it is creating just a relentless drumbeat of tragedy that we can never afford to get numb to, we can never afford to get complacent about, gun violence is absolutely ripping us apart as a city, and it's something that we have to stay really focused on. And I think we have been in developing this new set of tools. I think we are at a moment where you're asking for the right thing at the right moment, you know, to really think about creating some structure to make sure that we're maintaining our focus on this. And I'm really interested in working on this with you to make sure that we sort of think of a structure that can create some accountability. So thank you for that call to action. Thank you for highlighting the issue, and thank you all for your work on this and the many other things that the Civil Rights Commission does.
Thank you.
Thank you.
Next up, we have Councilmember Ellison.
Thank you, Mr. Chair. I'll echo what my colleagues have had said so far. I mean, our city has been devastated by gun violence. We've seen the economic strain with people being out of work, with the pandemic, having kids out of school and people out of work, really exacerbate these issues. And we have built a lot of infrastructure, and I love what you all are doing and proposing and support it, because I think it acknowledges that there is no switch to flip, right? That we have to dig in hard, and that it's going to be a lot of labor, a lot of hard work, a lot of hard conversations in order to really address this. Myself and Councilmember Fletcher, and Councilmember Cunningham know, and Councilmember Fletcher know viscerally the impacts that gun violence has for the families and the residents who we represent. And I know every single one of my colleagues has felt that as well. And so I just want to thank you for everything that you've put into this, and getting more coordinated, building more infrastructure to address this, so that we are not only managing the problem, but at some point feeling like we can claim a real victory, like we've saved a lot of lives. I think that that's what we are all working towards, and just appreciative to have you all in this fight and doing the work and leading in a lot of ways. So thank you.
Thank you, sir.
So that's it for the council members that we have in queue. I will just add that, you know, in addition to this being a call to action, it's there's also some recommendations for some specific work, as my colleagues spoke to. So I think it would be good for us to continue being in conversation about how to actually operationalize and implement some of the recommendations. This having these kinds of concrete recommendations from boards and commissions such as the Civil Rights Commission is the best kind of work that comes out, in my opinion, of these boards and commissions, because we get to take these the feedback directly from community members who are experts in their fields, dedicated community members who are volunteering their time to bring forward really thoughtful proposals that can be translated into policy. So I think there's still definitely some work to be done here as we move forward. I look forward to remaining in conversation. Cindy, I see you across the street sometimes, so looking forward to remaining in conversation with you all about this work and continuing moving forward. With that, are there any other?
Mr. Cunningham, I would just like to know your advice on next steps. What would you advise, or any of the council members, what would you advise for next steps?
So I will follow up with you so that we can get on the calendar.
Thank you, sir. It's truly an honor to be here. I thank you. The Civil Rights Commission thanks you for your time and all that you do. Thank you. Sorry for my little friend.
It's all good. I get the struggle. Thank you so much, everyone. Are there any other final questions or comments from my colleagues? I am not seeing any. Thank you to the whole team, and we will keep moving forward. This work is critically important. Next up, we shall be moving to our last discussion item for today, which is receiving and filing our monthly update report on COVID-19. I would like to welcome Commissioner Gretchen Musicamp from the Minneapolis Health Department. Welcome, Commissioner.
Thank you, Mr. Chair, members of the committee. We have before you a PowerPoint that lays out some of the topics that I'm going to talk about. So let's go to the first slide. By the way, I'm Gretchen Musicamp, Commissioner of Health. So as you can see in this graph, we have seen better times in this summer than we are seeing now. And the Delta variant has really taken over. It's a dominant strain in all of the cases. 90-some% of the cases are the Delta strain, and it is a very effective version of the COVID virus in terms of transmission, and so it is driving up cases. And the CDC has identified a couple different levels of concern. And one is, I'll get to that terminology. I always forget: widespread and then high. And so we are currently at a high rate here in Minneapolis. The light blue line is Minneapolis, and the state is at the second highest level. And that is causing us to look at what kind of capacity do we have within our hospitals. How is that impacting the deaths that are occurring because of COVID? So far, hospitalizations, ICU admissions, and deaths have increased, but not to the same levels that we have seen in previous surges. And so this graphic before you is really just from June 1st of this year till now. And so you can see earlier in the summer, we had much lower rates, and they are increasing at a very significant pace. Nearly all hospitalizations and deaths are now amongst unvaccinated people. And these trends are similar to other cities across the country where vaccination rates are relatively high. And so our lower rates of hospitalization and deaths, at least so far, we believe can be attributed to a higher vaccination rate, and I'll talk about our rates on another slide. And we are seeing more cases amongst unvaccinated. The majority of cases are amongst unvaccinated people who are experiencing more severe diseases. I think those are the main points I wanted to cover on this slide. Let's go to the next one. So talking about the Delta variant, as I mentioned, it's really taken over in terms of pushing all the other variants out of the way. And so 94% of the cases in our region are Delta variant, and only 2% of them had been the Delta variant back in early June. So things have changed very quickly. And as I mentioned, it's resulting in more severe disease and deaths, mostly amongst unvaccinated people. And breakthrough cases, those are cases where people are fully vaccinated. We see them increasing, but vaccines remain highly effective. And so many people think that the increase in breakthrough cases is just because there's just more virus around in the community overall. So the percentage of breakthrough cases is only about 1.7% of all cases. And when we look at those folks who have been fully vaccinated and we look at their breakthrough cases, it represents less than 1% of cases. So still the vaccines are highly, highly effective against this variant as well. All right, next slide, please. And so the CDC has recommended, and the city has followed suit, that masks are recommended in indoor places regardless of vaccination status. And so that's new. Science has shown us that earlier variants, if you were vaccinated, you were not able to really, and became infected with the variant. Those earlier variants, you were not able to spread to others. That is not true for Delta. And so that's why we have different recommendations today than we've had in the past. With Delta, if you have been fully vaccinated and you happen to get infected, you are able to shed the virus and share it with others. And so you are infectious. And so that is why we are recommending masks for both vaccinated and unvaccinated people. Here in the city, we are saying that in buildings, masks are required, as we have also required that city employees wear masks during work hours when they are in indoor spaces. And we're seeing that businesses and other venues are encouraged, we are encouraging, and we're seeing that they are complying, encouraging or implementing mask requirements for their employees and their customers. We want to remember that in addition to masks, we get focused on masks, and of course we need to be focused on vaccines, but social distancing is still an important protective factor, as is hand washing. And so masks, social distancing, hand washing, and hopefully continuing to increase the number of people that are fully vaccinated. Next slide, please. So in Minneapolis overall, when we look at people 15 and older, 87% of Minneapolis residents in that category have received at least one shot, and 82% of people in that age category are fully vaccinated. So we as a city are doing quite well, better than the state as a whole. Our health department has run clinics. We continue to run clinics, and I'll talk about those in another slide. We've to date distributed about 25,000 doses, but we know there are many other places that people are able to get vaccines and so are doing that. Next slide, please. So this is a map that shows you the vaccination rate for those for the population that's 15 and older in each zip code. And you will see that while we are doing well as a city as a whole, there are still pockets with lesser vaccinations, but we are seeing increases in every single zip code area. And in fact, we couldn't say this the last time I presented to you, but now we can say that every zip code has reached at least 50% of the people 15 and older who have received at least one dose. Most zip codes are above 70%. The lowest rates are in the Cedar Riverside area and surrounding that area and the near north. But as I said, the numbers are increasing in those areas as well. Next slide, please. This is a very similar picture, but it is about fully vaccinated. And we know that that's really important. One vaccine does not really give a lot of protection. And so people need to be fully vaccinated. In the case of Johnson & Johnson, one vaccine is fully vaccinating a person. Our current focus zip codes continue to be on 55403, 55404, 55411, 12, and 55454. Recent example of a success, we had a vaccine effort on the 24th Street Somali Mall, and we were able to vaccinate 33 individuals in partnership with Black Nurses Rock. So that is the scale at which we're moving right now. We are seeing more interest in vaccines here as they are seeing across the country and across the state. Next, please. And so this is a rundown of some of the vaccination opportunities. We continue to run a weekly opportunity at Park Avenue United Methodist Church Saturday mornings. And I'm sharing this with you because it's really important to get this information out. Because we have seen an uptick in interest, we want to make sure that people are getting the information to go along with that interest. And you can see here listed some other one-time events, Lincoln International Charter School, Agape, Stevens Square Park. And we know that incentives are often an important ingredient into getting people from maybe to yes. Hennepin County is offering a $50 Visa gift card for the first dose and another one for a second dose, and we are in partnership with them in distributing them. So far, that campaign is only going through August 15th. The state has a similar campaign with a $100 Visa gift that you apply for online and get after the first shot, and that is also due to end August 15th unless both of these campaigns are extended. And we urge people to visit the state's community vaccination website for vaccination locations as well. We are in anticipation of school, working with schools as well, Minneapolis Public Schools and charter schools, to see if we can bring them the Pfizer vaccine for students 12 and up. And that is certainly also being offered at some of the state vaccine opportunities. And those state-run locations include the Minneapolis St. Paul International Airport, the Mall of America, and Roy Wilkins Auditorium in St. Paul. Next, please. Outreach is really important, and we know that people's readiness, their readiness to hear messages, the way that those messages are delivered, who delivers those messages, all of those are important in getting people ready to be vaccinated. And so new in this list is in the middle there, the vaccination is protection. Now it's your turn videos. These have been done in conjunction with our community partners, and you can see we have them geared towards African American community, Native American community, Hmong, Lao, Somali, and Spanish. And there's also a composite video that really pulls together all of those communities together in one video. They're very short. I urge you to put them in places where other people might tap into them. We also know that hearing from trusted doctors is important, and so we have different videos focusing on conversations with physicians who are from various communities, and we have already on file the one in Spanish and the one in Somali, and the new one is with North Point Health and Wellness in English, and so that's one of the new tools that's available to be shared. All right, I think I am. Let's see, is there anything else to point out? I think you can see that we have some materials for back to school. other materials as well. And the city hub is an excellent location for finding some of these same resources, but there are links that are hot within this presentation as well. And then I think we have a final slide. So we were in the process of demobilizing because before the Delta variant really began to accelerate in our community here, we were feeling that it was possible to move many of the activities that had occurred through an emergency structure and put them back into the operations of the department. And so we did complete that at the end of July. We are continuing the core functions that we believe we're being called on to provide. Case investigation and contact tracing. The number of cases has gone way up, and we are looking at recruiting additional staff into the team so that we can manage the caseload. Communications and outreach will continue to be a focus, and vaccination planning and distribution. We also have a new 1-year CDC grant to work on flu and COVID vaccination outreach. And that is not to pay for vaccination efforts, but only the communication about them. And so we are putting together a plan to do just that using these funds. And really, we're using it to focus on increased awareness, access, and confidence in both COVID-19 and flu vaccinations amongst adult members of certain racial and ethnic groups. So that is our recap today. And as a city, I know that we're working on a lot of additional efforts for our employees and also thinking about the city as a whole. And if you have questions on what I have said or anything else, I stand to answer them if I can. Thank you, sir.
Thank you, Commissioner. First up, we have Councilmember Fletcher.
Thank you, Mr. Chair, and thank you, Commissioner. I've been getting a lot of questions about vaccine mandates. Obviously, a lot of private businesses are moving to requiring vaccination or proof of vaccination in order to attend events or participate in some kinds of activities. I'm curious, I've been hearing a lot from businesses that they feel like it's hard to enforce themselves or to know what they're able to do, that it would be helpful if we had a uniform policy. I'm curious if that's something we're exploring. And then I know I've been getting a lot of questions too about requirement for municipal employees following the state's announcement that they're enacting such a requirement for state employees. So I wonder if you can comment on those two policies and where we are with those.
Yes, thank you, Mr. Chair, Councilmember Fletcher. There aren't a lot of places that have done, or there aren't, to my knowledge, places that have fully implemented the notion of requiring vaccine across the community. Folks look to New York City. I don't believe they have fully implemented their ideas yet. And so we are certainly watching and learning from other communities and how that plays out there and what we might be able to learn from that. As you noted, the state yesterday did issue expectations for their employees that they be tested regularly unless they are vaccinated. And so we are, as a city, working with HR and elected leaders, the mayor's office and others to see what we can learn from that approach and see how it might be appropriate to apply it here. And so I think we can look for some continued conversation, but hopefully some recommended action in the not too distant future, especially related to our city and our city employees, rather.
Great, thank you, Councilmember Fletcher. Did you have any follow-up questions to that?
Just one, I guess. Thank you. I guess I'm curious if I know our state of emergency is set to expire in the not too distant future. So we need to start thinking about making a decision about that. In your view, looking at the trends, is this, or do we look like we're headed for a fall where we need to maintain the state of emergency to continue emergency regulations like masking in municipal buildings and others that we've put in place recently?
Councilmember Fletcher, Chair Cunningham. Yes, when we look at the experience with the Delta virus in the United Kingdom or in India, we see that it has a spike that is maybe ends more quickly than some of the other strains, but nonetheless has been about 2 months in length. And so it doesn't appear that we have reached the peak of our spike here. And so, yes, I think we can expect that we will continue to have a lot of transmission and cases in our community well into the end of September.
Thank you.
Great, thank you so much. Say the numbers are very disappointing, you know, and this is so much bigger than just Minneapolis with what we're dealing with here. But our vaccination numbers are looking really good, going up and up. Having every zip code having at least 50% of folks having at least one shot is incredibly impressive and reflective of the incredibly hard work and smart work that your department has been doing under your leadership. So thank you for that. I know that when we're having a disappointing setback like what we're in now, it can feel like the hard work isn't being seen, but I want you to know that it is being seen. If you could please pass that along to your team as well, that the work is appreciated, is life-saving, and I'm excited. Just so my colleagues are aware, in case it maybe slipped through, today on the consent agenda, we actually approved some additional revenue related to our health department helping support Minneapolis Public Schools with their COVID-19 contact tracing efforts, because we know that kids under 12 can't get the vaccine yet, and we are seeing a huge spike in children who are getting sick, and so we can't rest. You know, we can't feel like we're done, pandemic over, because those numbers show us very much so that is not the case. So, you know, thank you, Commissioner, for all of your work, and I will continue to boost signal all of the efforts and opportunities in my newsletter as a council member and my social media to be able to make sure that my constituents and followers more broadly are aware of the opportunities and the needs. So thank you so much again. Are there any other questions or comments from my colleagues? All right, I'm not seeing any. That concludes the business before us today for this agenda. Thank you to all of the city staff who keep our city running each and every day. Without you, our city would not be functioning, and so I'm grateful to you and all of your teammates. With that, I will consider this meeting adjourned. Thank you, everyone.